A staggering over 1 million people in the US get kidney infections each year, one every minute. But it's not just a US issue. Worldwide, around 150 million people are affected by urinary tract infections, UTIs, annually, with a significant portion developing into kidney infections. What might seem like a bad cold could actually be a serious kidney infection. What often starts as a simple urinary tract infection, UTI, can escalate into a severe condition if not addressed promptly. Let's uncover the signs you shouldn't ignore. Welcome back to Nature Cures and Cares, your go-to spot for insightful health information and natural remedies. Today, we're spotlighting a crucial topic: spotting kidney infection symptoms early. Over the next few minutes, we'll explore the key symptoms you need to watch out for. Whether you're concerned for yourself or a loved one, the information we're about to share could be a game changer for your health. Stick around as we break down the symptoms you need to know for a healthier tomorrow. Ever wondered what a kidney infection really is? Picture this: it starts with pesky bacteria invading your urinary tract through the urethra. From there, it can travel up to the bladder, giving you a lower UTI. But if these troublemakers aren't stopped in their tracks, they can climb all the way up the ureters to your kidneys, turning a small issue into a serious kidney infection. Let's break it down and see why catching it early is crucial. Symptoms you shouldn't ignore. 1. UTIs might seem like a minor inconvenience, but they can escalate quickly if not handled. Bacteria can hitch a ride from your bladder up to your kidneys, turning a simple infection into a serious problem. Frequent UTIs? That's a red flag that you could be at higher risk for a more severe kidney infection. Stay alert and treat them early. 2. Kidney stones are like little, hard deposits that form in your kidneys. They can be pretty painful and cause trouble when they move or grow. When they block the urinary tract, urine can't flow properly, leading to a buildup. This stagnant urine is a prime spot for bacteria to thrive, and those stones can even trap bacteria, making it easier for infections to start and spread to your kidneys. 3. Diabetes, with its high blood sugar levels, can really shake things up when it comes to infections. High sugar levels are like a welcome mat for bacteria. Plus, diabetes can weaken your immune system, so your body's not as good at fighting off infections. This makes it easier for bacteria to set up shop in your urinary tract and potentially move up to your kidneys. 4. When your immune system is weakened, whether because of chronic illnesses like HIV, AIDS, cancer treatments, or meds that suppress immunity, it's like your body's defense team is on a break. This makes it harder for you to fight off infections. Bacteria that sneak into your urinary tract can take advantage, multiply, and head up to your kidneys, raising your risk of kidney infections. 5. Got a urinary catheter or know someone who does? Here's a crucial heads up: catheters can be a gateway for bacteria to invade the urinary tract. If they're not kept clean or are used too long, they can become a bacteria highway. Plus, catheters can mess with the natural flow of urine, making it easier for bacteria to settle in and cause infections. So, keeping an eye on catheter care is key to reducing your risk of kidney infections. 6. Did you know pregnancy can increase the risk of kidney infections? Yup, it's true. Expecting moms, be aware, all those hormonal and physical changes can mess with your urinary tract. As your body adjusts, it can slow down urine flow and create a perfect spot for bacteria to thrive. If you're pregnant, keeping an eye out for symptoms is key. Your body is working hard, so make sure to stay on top of your health. 7. Did you know women are more prone to kidney infections than men? It's all because of anatomy. Women have a shorter urethra, so bacteria can travel up to the bladder more easily. This makes infections more likely. But don't stress, knowing this can help you take steps to stay healthy and prevent infections. 8. Did you know that age can play a big role in your risk for kidney infections? That's right, older adults are at a higher risk for developing these infections. As we get older, our bodies go through a lot of changes, including the urinary tract and immune system. For example, aging can affect how well the urinary tract functions and how efficiently the immune system responds to threats. This means that the older you get, the more challenging it can be for your body to fight off infections and keep everything running smoothly. 9. Let's look at how chronic health conditions can increase your risk of kidney infections. Conditions like hypertension and chronic kidney disease can make you more vulnerable. Why? High blood pressure can damage the small blood vessels in your kidneys, making it harder for them to filter waste and fight infections. Chronic kidney disease weakens your kidneys over time, making them less able to handle everyday stresses. 10. Let's talk about how blocked urine flow can increase your risk of kidney infections. When urine can't flow properly, it backs up in the bladder or kidneys, creating a prime breeding ground for bacteria. Imagine it like a traffic jam. When urine gets stuck, it's a setup for trouble. If you have issues that affect urine flow, stay on top of your health game. Managing these problems can help prevent infections and keep your kidneys in top shape. 11. Frequent sexual activity can affect your risk of kidney infections. It might surprise you, but lots of sex can bring bacteria into your urinary tract. Here's the deal: bacteria from the genital area can transfer to the urethra during sex. If these bacteria travel up the urinary tract, they can reach the bladder and even the kidneys, leading to infections. If you're active, practicing good hygiene is key. Simple things like urinating after sex and drinking plenty of water can really help keep your urinary tract healthy and infection-free. 12. Your personal hygiene can significantly affect your risk of kidney infections. Believe it or not, how you wipe after using the toilet can make a difference. Poor hygiene can lead to bacterial contamination, with bacteria from the genital or anal area potentially reaching the urethra and traveling up the urinary tract. To lower your risk, make sure to practice good hygiene. If you're at risk or notice any symptoms, don't hesitate to seek medical advice early. In wrapping up, knowing what can increase your risk of kidney infections is key to keeping your kidneys healthy. Whether it's managing chronic conditions, practicing good hygiene, or staying on top of physical changes, being proactive makes a big difference. Regular checkups, a healthy lifestyle, and tuning into your body's signals are all part of the game. Stay informed, take charge, and give your kidneys the care they deserve to keep them running smoothly. Before we continue, if you feel we have added values and you're new here, consider subscribing and hitting the notification bell so you don't miss any of our health tips. Let's talk about something really important: spotting the signs of a kidney infection early on. Trust me, recognizing these symptoms can be a game changer. Why? Because catching a kidney infection early can help you get the right treatment faster and avoid complications. 1. If you've got a kidney infection, you might feel pain in your back, side, or belly. This is often described as flank pain, pain in your lower back, just below your ribs, and extending to your side. It can be a dull ache or a sharp, stabbing sensation, and it might be more intense than usual muscle soreness. If this pain is accompanied by fever or frequent urination, it's wise to see a doctor. 2. These are super important to recognize because they can give you a heads up that something might be going on with your kidneys. So, what should you be looking out for? Here are a few key symptoms. A frequent urination: if you're hitting the bathroom way more often than usual, it's worth noting. It's not just about the urge, it's about how often it's happening. Pain or burning sensation: if urination feels sharp or burns, that's a red flag. It might mean an infection is irritating your urinary tract. Cloudy or bloody urine: if your urine looks cloudy or has a pinkish/red tint, it could be a sign of blood or other issues. Don't ignore it, these symptoms often point to an infection. 3. A high fever means your body's cranking up the heat to fight off an infection, like a kidney infection. Those sweats you're feeling? That's your body's way of cooling down after the fever. Both are signs your body's in battle mode. If you're sweating and feverish, especially with other symptoms, it's time to see a doctor. 4. Ever feel nauseous or start throwing up and wonder what's going on? When your kidneys are infected, your whole system can get upset. This can lead to that queasy feeling in your stomach and even make you vomit. It's your body's way of reacting to the infection and trying to clear out anything that's making you sick. It's a sign that your body needs some extra help. Don't ignore it. 5. When your kidneys are infected, you might feel unusually tired or just not yourself, like you're running on empty. This deep fatigue is a sign that your body is working hard to fight off the infection. It's your body's way of telling you it needs help. If you're feeling worn out and have other symptoms, it's smart to check in with a doctor. They can provide the support and diagnosis you need to get back on track. 6. Hey there! Feeling unusually confused or disoriented? It could be a sign that an infection is hitting you hard. Sometimes, severe infections can mess with your mental clarity, making it tough to think straight or stay focused. If you're experiencing this, it's a clear signal that you need to reach out for help. Your body's trying to tell you that something serious might be going on. Kidney infections are serious enough on their own. They can sometimes lead to even bigger issues if not treated properly. For that reason, let's explore why it's so important to address a kidney infection promptly. So, what kind of complications are we talking about? One major concern is kidney damage. If an infection isn't dealt with quickly, it can lead to lasting harm to your kidneys. This can affect how well they function and may lead to chronic kidney problems down the line. 2. Another serious complication is sepsis. This happens when the infection spreads from the kidneys into the bloodstream, causing a widespread reaction throughout your body. It's a severe condition that can affect multiple organs and requires immediate medical attention. Both of these complications are why it's crucial to recognize and treat kidney infections as soon as possible. The sooner you get help, the better your chances of avoiding these serious outcomes. So, keep an eye on those symptoms and don't hesitate to reach out for medical advice if you're feeling unwell. Taking action early can make all the difference in protecting your health and preventing complications. If you found this video helpful and want to keep getting great health tips, don't forget to hit that like button and subscribe to our channel. Got any questions or experiences with kidney infections? We'd love to hear from you. Drop your comments below. Before we wrap up, remember that this video is for informational purposes only and not a substitute for professional medical advice. Always consult with your healthcare provider for personalized advice and treatment. Remember, nature cures and cares.